the Allied Health at North Monaco is for anyone interested in a career in healthcare. So if you are an honors or AP student in science, I'm looking for you. I'm looking for someone that's interested in a career in medicine, nursing, respiratory therapy, pharmacy, laboratory, any emergency medicine or operating room careers, cardiology, physical therapy, radiology. Those are some of the places that the students' careers are taking them to. So anything related to healthcare. And what we do is I taught this course for Montgomery County Community College. I'm adjunct faculty in both their nursing and their medical assisting programs. So I taught this course for the medical assisting program, and it covers the units on infection control, which all these are applicable to any career in healthcare, anatomy, physiology, and pathology. There's medical terminology throughout the entire program. We talk about caregiving skills and we demonstrate these skills. The students learn how to take vital signs, so temperatures, blood pressures, pulse, respirations, and they do pain assessments. So they all go through, learn how to do this. They do vital signs on each other. And there's a unit we completed on communication and crisis. So we talk about interviewing skills, which you're going to have to do whenever you come in contact with a client and any new admission. We talk about these skills as it relates to the medical office, as well as to the inpatient setting. And then we talk about these patients and their needs throughout their entire lifespan, from infancy to the elderly. We talk a whole unit on clients' rights and health and healthcare provider rights. We do a unit on medical ethics and legalities, and then we do some client and caregiving skills. So they learn how to make a bed, how to change linen, they learn how to feed patients, how to transfer patients. We just completed an entire rotation module on first aid. So they get certified in first aid. They also learned how to walk with crutches, canes, walkers, and wheelchairs. So they were able to do all those skills while we were going ahead and doing it. Originally, this program was supposed to be at Lansdale Hospital. This year, because of COVID and the pandemic, we are not in the hospital. Some of the rotations that we do are pharmacy, emergency, intensive care, operating room, medical surgical floors, orthopedics, respiratory therapy, laboratory, and radiology. How we're doing the clinical rotations this year is Zoom conferences with allied health professionals. So next Wednesday, I have an orthopedic surgeon that's coming to Zoom with us, and he's going to talk about his career. We have pharmacists that are Zooming with us, the National Guards talking to us about military medicine. We've Zoomed with respiratory therapists. We've Zoomed with psychologists, speech pathologists. So we are getting our clinicals by researching their careers, learning about their duties, their responsibilities, their educational requirements, their salaries, and how they help patients. So these are all the things that we are researching and focusing on to complete our clinical rotations this year. These are, again, we had a great chiropractor who actually works with the sports teams in New York and in Philadelphia. And he was talking to us about his chiropractic medicine and how he treats clients. So again, those are some of our guest speakers. So what I talked to you about, some of the skills, we have a mannequin, we have a hospital bed in our classroom that we're using, and we go through all the skills. No matter what health care provider you are, you will learn how to do some of these skills. We also go ahead and, again, learn how to do a throat culture. We work with isolation and how to put on the personal protective equipment that is in the news with COVID and sterile gloving. This is a picture of our classroom that we are in, and the students end up with several certifications. So they get their health care for CPR for healthcare providers certification, which is good for 2 years, and the first aid certification. They're going to get a HIPAA certification, as well as OSHA for healthcare, so they will be able to get that wallet certification. And then during the in between the Thanksgiving and Christmas or holiday break, when we went virtual, the students were able to get their Pennsylvania Department of Human Services adult residential license and personal direct care staff person certification. So if they had a family member or relative that received services in the home from the Pennsylvania Department of Human Services, they were able to take care of elderly patients in their that were in their home and get paid for taking care of these clients in their home. Now that they have this certification, they can work in nursing homes with it over the summer as like an internship. They'll have this certification to go ahead and do. So what you need is manual dexterity. You need to have good, strong hand-eye coordination. You need to be able to lift a minimum of 50 pounds to do this course. We're in the hospital, so we are working with clients. So you have to be able to push, pull, move clients, and stand for long periods of time. Those shifts in the hospital are 12 to 13 hours long. So you need to be able to go ahead and be on your feet. Some of the costs of the program: you need to obtain a physical exam, have a negative 2-step tuberculosis skin test or a blood test, proof of your hepatitis vaccination. You need to have a cleared criminal background check, and that's part of anybody that works in healthcare. A seasonal flu shot is required. So if you can't get the flu shot, you cannot attend the program because we are planning on being in the hospital. And you must be able to provide your own transportation to and from the hospital. So you need to either have your parents drive you or you drive. Your home schools do not provide transportation for allied health. The students wear green scrubs. They're olive colored scrubs. They cost about $40. You need to have a wristwatch with a second hand to take respirations and pulses. Sneakers that are leather. You purchase a workbook, stethoscope, and a blood pressure kit or sphygmomanometer through this. And then how to apply is you go on to our website at North Monco, and you submit you go under programs, find allied health, submit the North Monco Technical Career Center application. It is due to me by February 19th. It's due to your counselors by February 12th, I think, but it could be different for your school. You have to submit a copy of your transcript, submit one letter of reference from a science teacher. If you are virtual and your science teacher doesn't know you, you need to do it from a science teacher that does know you, like from last year. Only 36 students are accepted into the program. We have 12 per session. I hold 3 sessions a day. Session 1 is from 7:30 to 8:45. Session 2 is from 9 to 10:15, and then session 3 is from 12:45 to 2 p.m. So those are the 3 sessions that I hold. Methactin generally runs in session 2 or 3, but that's really up to your guidance counselors on how this works. And again, once you are selected, you go through an interview process to say how Allied Health why you want this career and how you think the program's going to help you. This is a picture of our uniform that the students wear every day to class. And again, with COVID, we're Zooming with allied health professionals. We're researching our careers. We're doing patient education projects. And that is pretty much what we're doing. Again, the application is on our website under programs, allied health applications, and then you can find that information there. You fill out the top portion of the application. Your parent needs to sign the application that they agree for you to be in the program. You need to ask your science teacher within the last 2 years for a letter of recommendation that can be emailed me or to submitted with your application. And then again, your guidance counselor will send them over to me, your applications. And here is my contact information. So, what questions do you have for me about allied health? Go ahead,
Miss South.
Matt.
Oh, go ahead, Matt. Sorry.
I'm not sure if I can exactly ask this because it could be like confidential information, but
Okay.
since the allied health application, it seems to only persist of like a few questions about extracurriculars, what your career goal is, and then a letter recommendation. Does everyone get selected for an interview, or is there like a what makes you stand out as an applicant for the application?
So I look at your grades. I look at what classes you took. I look at a lot of the extracurricular activities that you do because you have to be there for this program. So if there's a lot of people that are leaving, every day for sports and you're in session 3, that's not you're going to miss a lot of information. So I look at those things when I'm looking at the application. Some students said, "Hey, I need to stand out more." So they wrote me an essay about why they want in my program and why they want to go ahead and how they think it could help them. So that was something that they did above and beyond. A little bit about myself is that I graduated from Hahnemann University. Right after I graduated, I went into the United States Navy active duty. I did 2 tours active duty in intensive care, critical care, and pediatrics in the Navy. I got all my certifications for every adult certification that there was, shock and trauma, cardiothoracic, everything from the Navy, and my entire career has been inpatient, ICU, and emergency room. So I have my cardiac clinical nurse specialist and my advanced nurse practitioner, and I'm faculty at Montgomery County Community College, like I said. And this is my first year teaching allied health for North Monco. So I'm excited to be here. I love 12th graders. I enjoy all your energy that you guys have and your perspective, that the teenage perspective that you all bring. So the class is really focused on skills that any allied health provider or practitioner would go ahead and need. Did that answer your question, Matt?
Yes, thank you.
Okay, go ahead.
I had like a couple questions. So first of all, is this like a whole year thing, right? Like,
It is a whole year thing. Yes. We're from August until May. So yes, we finish right around your AP classes that you would take. And it is, the credit that you get is from North Monco. Will go ahead and put that to your home school for your transcript.
okay. And is there like a specific number of students you pick from each of the schools?
I try to make it fair. What I heard is some of the schools go ahead and submit more applications or have a lot more interest. I'm really interested in making it fair with the 5 school districts. So if I have somebody that really stands out, I will go ahead and, give that school district more to go ahead and do it. It's really based on, your a lot of emphasis, like the application we kind of had to streamline. What I was looking for is when I interview you, I'm going to ask you questions about your interests and if you did any, you know outside projects, or were able to do a shadowing at a doctor's office, or a facility or anything like that? Like, what did you do to like decide that you wanted to go into an allied health profession?
Okay. And also like I noticed you said like you do 3 sessions per day. Just like the student, like once you like accept them or not, do they get like an input on what session works for them? Or is it like
That's a good question. So you can tell me the session that you're interested in, but truthfully, that's up to your guidance counselors. So how it fits into your schedule with your workload, I work really closely with the guidance counselors to figure out what session is, where people will go ahead and fit. I will give them your preference as to your first choice, second choice, and third choice to go ahead and do. I guess one thing I didn't share with you is my groups that meet session one at 7:30, they are in person this year. In person 4 days a week, Monday through Thursday. All students are virtual at North Monco this year on Fridays. So on Fridays, they have a research assignment that they're doing on the allied health professional or the disease process that we're doing. So while we are in person, we are doing skills, and we are doing our theory in person. The allied health class has three different components. It has a theory component, which is calculated as 40% of your grade. It has a skills component, which is calculated as another 30% of your grade. And the last 30% of your grade comes in work ethic. So being there, and being prepared, turning in your assignments on time, all of that impacts your grade.
okay, thank you.
Sure, go ahead, Ria.
Oh, I was just curious, are we going to be completely in person next year if you're in allied health, or is it going to be a hybrid schedule?
Um, the way that the North Monco administration feels is that with this allied health program, you cannot learn the skills virtually, that they want allied health in person, just like, and I was kind of telling my students this when they were telling me about a snow day. So I'm like, in allied health, you don't get a snow day. Like, if we are in session, you have to be there. So we are looking at doctors and nurses can't just not show up to work because patients rely on them. So the hospital operates 24 hours a day. And the goal is that we will be, Allied Health is one of the very few programs that and is there 4 days a week in person. So it is, I assumed because the pandemic started, that we were in person 4 days a week this year. We will be in person next year. We wear masks. We hand sanitize when we walk in the door. We have wipes to wipe off our computers and our chairs and our tables. We wear gloves when we go ahead and perform our skills. We socially distance, but we are in person. We have to live with the pandemic.
I just wanted to ask one question that's not really related. It's related to your program in the sense that it deals with the health sciences, but with the pandemic, since you were just talking about it, are there any areas in the health sciences that you see a new need or an increased need for as these guys try to figure out a path ahead?
So that's a good question. So it's very interesting as we are Zooming with our allied health professionals, and the pandemic has changed so many of the ways that we normally functioned. In respiratory therapy, there was a huge ever since I started many years ago, we gave a lot of aerosolized therapies when we were going ahead and treating like our asthmatic patients and our COPD patients. And now, because of the pandemic, we're not doing that therapy anymore. We're using more inhalers so we don't aerosolize the droplets. So what I see is because the pandemic, and I just talked to the students, we just started a new unit on pathology today. And what we were talking about is we're looking at disease and we're looking at health. And health is not just the absence of disease, but it's like talking about the social impact of health. And we're talking about the mental aspect of health. And really, when we are talking with our psychologist and Zooming with them, mental health is a huge area that we need more practitioners in, especially for young adolescents all the way through. People are having a very difficult time with the change. We just were talking about risk factors and stressors today in class. And one of the biggest things that we're seeing is people that used to go into the office every day are home and they are socially isolated, just like the students who are virtual and don't get to interact or get to hang out with their family during breaks or holiday events. People are isolated and it is impacting mental health and issues with mental health. So an influx of mental health providers. And another thing that we're doing is we're like taking this through to all aspects, whether you're a nurse or a doctor, the patients that come into the hospital right now, they might come in for an infection, but the majority of our patients are stressed and have mental health issues, whether it's anxiety or depression, that we have to learn how to deal with. So these are things, all the comorbidities that we're looking at. And I bring that up throughout all the disease processes and in all the modules that we do. Yes. Is there anybody else?
I just like to say one more thing. Oh, sorry, since Security. I just want to say one thing. I teach anatomy and physiology at the high school, and I want to say that this program, Allied Health, is such an amazing program, and it's such a great opportunity for a high school student to be exposed to this level of teaching and just actually clinical experience. So if you're not sure, I know a lot of people on this call are underclassmen. So as you're starting to plan ahead to your senior year, I just want to ask, are there any classes that they should try to take to maybe increase their chances of getting into this program?
So I'm looking for people that have a strong background in biology. That is going to help you a lot. So I'm looking at if you have the anatomy and physiology, that's great because every class that you take in college, like when I was at Hahnemann, we took anatomy and physiology from the doctors that taught the medical students. They were our professors. So again, anatomy and physiology will help you. Biology is certainly going to help you. Medical math is huge. So again, you don't need a strong calculus background, but you need to be able to do algebra and do it well to go ahead and calculate out prescriptions and to do calculations to hang IV drips and IV meds. So again, these are strong things that we're looking at. So I'm looking at your math courses, chemistry, but I'm really looking at biology, anatomy and physiology, and those chemistry classes that look there along with algebra 1 and 2. So I'm looking at those grades. And like I said, I taught this exact course at Montgomery County Community College. I'm looking into, right now it's not dual enrollment with a college. This is my first year, but I've been approached by 2 different colleges that want this program as dual enrollment. So that's something I'm working on and going to anticipate for the future, because that was a goal of mine when I was hired to teach this, that that you could get college college credits for it. How soon that progresses, I don't know, but it is a goal of mine to go ahead and make it a dual enrollment class. So the students have a lot of fun. They were walking down the halls with crutches. They were walking down the halls with canes. They were learning how to interview. And now they are learning how to perform a head to toe assessment, a patient assessment that they do. So we do a lot of videos, we do hands-on skills, we do checklists so that you know what you're doing. And we want to make you a very well-rounded application, allied health professional. So that is something that we're seeing. So I hope that you're as excited about this program as I am. And I'm really happy I had the opportunity to talk to you about it, especially if you're, a freshman, a sophomore, or a junior, and you're thinking about a career in medicine. It is one of a few programs that you have the opportunity to go to. And how it's going to help you is I teach for the community college. So these are like the vital sign skills. These students are terrified when they come in and they have to learn all these skills at once. Now, because you're high school, I break it down individually and we get to go ahead and go at a slower pace so that we go ahead and do it. So when you get into your college program, you're already going to be a step ahead because you know the information, you heard it once before. So it's definitely going to help you. Does that make sense? Yes.
Um, if we have experience, do you look at experience when you look at applications?
I do. I have an EMT in my class, and he brings a wealth of information because he's like really the leader of his class. He like is right there to answer all my questions and give his experience. And he's 17, so he tells us about, the rides along that he does with the ambulance. And so I do look at the experience that you have. I definitely do because again, I'm looking for leaders in the class. I'm looking for people that can go ahead, and some people don't want to like talk a lot in class, and then I have other people that want to share all their information that they have. So it makes for a very dynamic class. And the cool thing is that you guys are with all 5 school districts. So in college, you're not going to know everybody in your class. You'll hardly know anybody in your class. So you get to be able to use those skills. And the students that are now, so I have one that got into University of Pennsylvania. I have one that got into Temple, several going to Penn State and Pitt. So you guys can network and you'll know people where you're going that are like going to be in your same career. So it's very exciting to hear what professions they choose. And sometimes they don't know. They just know that they want to go ahead and do something in medicine. And then when we research the career, they're like, this is something that I could do. I never thought about this before, but we not only did we research it, but we had an expert come in and talk to us. And now I'm thinking I might put that in as my career path. So it kind of opens your horizons to new things. So you don't have to know what you want to do. And it's okay if you don't. You just have to like medicine.
Okay, thank you so much.
Okay. Hey, you guys, I have enjoyed hanging out with you. I have 2 meetings to go to tonight. So I have another meeting that's starting. So I'm going to say good night to you. I hope to see you in the future. Apply for the program. I'll be excited to read your applications. And anytime you want a guest speaker, think about me. Okay. All right. Take care.
Thank you so much.
All right.
Thank you.
Bye-bye.